Hey everybody, we are here at the IMMH conference. That is your integrative medicine for mental health, and we are very blessed to be joined by Dr. Ganeshan right now, who is one of the world experts on folate, I would say. We appreciate your time. This is such a critical issue. We've been talking about MTHFR for a while and, not enough folate in the brain, and we limited ourselves on neurotransmitters, and people understand, I think, about folic acid being important for midline defects, even tongue ties, lip ties, all those things are midline defects. But there's some confusion, I think, in the world at large about the difference between folic, methylfolate, folinic acid, and they even call that one calcium folinate. So we've got a couple names for that. But you, at your lab, you are checking for folate antibodies, which this is new, right? I mean, last decade, I guess, of information about how our own bodies in an autoimmune process may be attacking our folate receptors. And so we are not getting folate in our cerebral spinal fluid. So our brains are deprived, even if our blood test shows up okay. So I won't do all the talking, but if you know me, I'm passionate about methylfolate, folinic acid, getting the right form for your body, for your baby. But I'm just excited to be here, to be honest, to talk to you about this. Dr. Fry's new book, The Folate Fix. Thank you for sharing that with me. How did you get into checking for folate receptor antibodies? Tell us a little bit about you and what drew you to that project.
So way back in 2016, a friend of mine called me to join him. He had was talking about folate and autism. That was very new to me. And he basically mentioned that if you have folate receptor antibodies, the treatment is high-dose folinic for kids with autism and other neuropsychiatric diseases. That excited me because I was in the drug development world developing pharmaceutical-grade products. And so I had this interest. I thought it's a personalized medicine tool. You have a problem, and then you give a supplement or drug, and that works, and that could be the best way to treat a patient. So you're not treating the unwanted patient. So that excited me, and I joined with him, and that's how this whole process started. So the folate receptor antibody as such was discovered, way back in early 2000s, and it was correlated. If these antibodies are present, there is low folate in the brain. Folate or vitamin B9 is very important for the nervous tissue growth and development, for neurotransmitter synthesis. Basically, it's like a fuel for the nervous system. If you deprive them, you can have disease, clinical consequences, which means you have some disturbances and mental disturbances.
So fuel for the nervous system. That is such a good way to say it. The brain doesn't have any fuel then.
Yeah. So, this is an easy way to explain. It's more complexity to us that. But first of all, I want to make sure that our audience understand the difference between folic acid, which is synthetic, not good.
Not good. Folic acid.
Folinic acid is what comes from folinic acid is good. It's a natural form, and 5-methyl tetrahydrofolate, which is the active form. So if you look at how it's formed, is that folic acid, when people take folic acid, that's the common thing we know around the world, including me. Before this whole thing, I would have assumed that folic acid and folinic acid are the same.
Folic acid is in so many vitamins, the majority of prenatal still. This is an important distinction.
Important distinction. It's not good. When you put too much of folic acid, it's not good for you. Our food is already fortified with folic acid enough. The idea of putting folic acid was to prevent neurotype defects. Idea was to, put and prevent. But unfortunately, too much of anything is synthetic is not good. And that is what is happening to us now.
It's almost like maybe it gunks up the receptors too. It's just...
Yeah.
It clogs the system.
Yeah, it clogs the system. That's the right way to... Then the whole folate receptor antibody is a total different subject. So let me explain to you how folic acid, the metabolism, how it's converted. Folic acid is converted by the enzyme dihydrofolate reductase to folinic acid. folinic acid is converted by the enzyme methyl tetrahydrofolate. That is your MTHFR enzyme. It's an enzyme. It breaks it down to 5-methyl tetrahydrofolate, which is the active form. When you have excess folic acid in your system, it forms something called the unesterified folic acid. This unesterified folic acid, what happens is it's a body's own way of making sure not more folate is converted into folinic acid. So it basically inhibits the enzyme dihydrofolate reductase and doesn't convert folic acid to folinic acid. And this particularly could have a lot of significance in the neuropsychiatric disease. So it solved a problem for some time. With the science, advancement of science, what we know today, I would prefer rather taking folinic acid on our patients. I wanted to draw a diagram and explain it to our audience. Okay. So if you say folic acid is converted by the enzyme dihydrofolate reductase into folinic acid. It's just a matter of a few letters, but just to make sure we know it exactly, it's folinic acid. It's converted by the enzyme MTHFR into 5-methyl tetrahydrofolate. So this is the active form.
And I think a lot of people ask me, they've heard about MTHFR mutation, which is totally separate from the issue of folate receptor antibodies, but is this the step?
Yeah, so basically what happens is the MTHFR is an enzyme defect. Some of us have this mutation which doesn't allow the conversion, but this is a natural way of our body telling that we have too much of folate.
Okay.
So in certain population, when they take too much of green leafy vegetables, this may be a way to prevent that. But evolution-wise, we have this small mutation there.
Okay.
Now, this 5-methyl tetrahydrofolate donates this methyl group, okay, one carbon, and that's along with B12 forms a cofactor for conversion of something called the homocysteine into methionine. And the methionine is converted to something called S-adenosyl methionine. And this is converted to S-adenosyl homocysteine and homocysteine back. Why is this important? This is the process to keep our genes quiet. Whenever you hear the word epigenetics, this is what it means. So if this is low, if your folate is low, this whole process is affected. If your folate is low, there is high homocysteine. High homocysteine is not good for our body. It's toxic to our body. And homocysteine forms the building block for something called glutathione. Glutathione is a very important part of our human system because glutathione cleans up all the oxidative stress. That means the rust forming in your body cells because of the cells are getting broken down. And because of the rust, your cells can get damaged and your body can damage. Your proteins, lipids can get damaged. But this is a process of cleaning up your rust. Now, if there's high homocysteine, ideally we should expect high glutathione. It doesn't happen that way. High homocysteine inhibits the glutathione formation. High homocysteine also causes low methylation. So genes are not keeping quiet, they're getting active.
Okay.
And high homocysteine also acts on something called the NMDA receptor, acts as a glutamate agonist. It acts as a glutamate, so aggressive symptoms and neuropsychiatric symptoms.
Yes, too much glutamate is very aggravating.
Now, people ask, what is the use of folinic acid? So this will be useful. I'll draw another diagram. Folinic acid is converted into something called guanine triphosphate. This guanine triphosphate is the building block for RNA and DNA synthesis. So your new cells, as you know, your cells are breaking down and new cells are forming, and this is very important. This guanine forms also something called BH4, tetrahydrobiopterin. Now, this tetrahydrobiopterin is actually a drug which is kind of $50,000 a year drug.
Wow.
Right. And this is used for a condition called phenylketonuria in pediatrics. Pediatricians know phenylketonuria. But it's also very important because it's a cofactor for tyrosine hydroxylase. Tyrosine hydroxylase. It's an enzyme which converts tyrosine into dopamine. It is also important for tryptophan hydroxylase, which converts tryptophan into serotonin. Serotonin is converted to melatonin. Melatonin is important for sleep. Serotonin is important for all the neuropsychiatric symptoms. Dopamine is converting catecholamines, give the energy. And it also converts arginine. It's also cofactor here, converts in nitric oxide. So neurotransmitters, your brain will be deprived of neurotransmitters. These are very important for the body and the brain. These serotonin and dopamine are very true. Dopamine, as you know, most of us know, is a hormone which causes happiness. And it's very important. If you have low folinic acid, you will have low GTP. Your low GTP will come from low BH4, and low BH4 means low dopamine, low serotonin, and low nitric oxide. Nitric oxide is what
allows the blood flow.
Makes the blood vessels bigger and more blood flow. So folic pathway is very important. Now, one more important thing is that this folic acid, when you give too much of the synthetic form of folic acid, it forms something called unesterified folic acid. Now, this, when it is in excess, tells the body, I don't need more folinic acid. So it inhibits, that means it prevents the formation of folinic acid. There's very important consequences, not only important here, and this BH4, once it donates the hydrogen atoms, and it becomes BH2. Now, the BH2 has to be converted back to BH4 for active. So, this process cannot stop. So keep on going on. It's not like you stop. And this BH4 is converted into BH4 by this enzyme dihydrofolate reductase. So if you keep giving too much folic acid, your whole this pathway may be affected. So that's a understanding of the folate pathway. And most of the doctors, most of us, including me, 10 years ago, if you asked me, I couldn't have told you about all this stuff. But this is very important in the children who are autistic and mothers who want to get pregnant. And, this is very critical.
I think there's so much misunderstanding. Like I said, I did a search on Amazon of all the most popular prenatals, the most popular children's vitamins. They're all full of folic acid. And essentially, based on what you've drawn there, I mean, it's harmful.
Absolutely.
It's the wrong form and it's harmful.
Very simple. Folic acid is synthetic. Anything synthetic is not good. That's a simple principle. Folinic acid is natural. That's good. So, with the knowledge we have, most of us are started using the advocacy to use either 5-methylfolate or folinic acid in supplementation, especially with the autistic kid. Imagine this is all happening in the brain. Body is normal folate. When you have these antibodies, what happens is low folate. It's not only in autism, but also depression, also schizophrenia, neuropsychiatric. Serotonin and dopamine are very important for neuropsychiatric disease.
Yes.
When they don't have enough of them, they can present as clinical symptoms. So some of the drugs used in depression are selective serotonin uptake inhibitors. What it means is they put more more serotonin in that place. But imagine if there's no folinic acid, that's not going to happen there.
Right.
There's
nothing going to help.
So
we're addressing the wrong issue, and we need to go more to the root.
Yeah. So root. Yes, exactly. So you want to look at all the food. Your food is fortified with enough folic acid. Just make sure you don't take any supplemented folic acid. You, your neighbors, your friends, just tell them folic acid is synthetic, folinic acid natural. That's what we want. Or 5-methylfolate, one of them would help you a lot.
Absolutely. Okay, so the basics of avoiding folic acid, that's like, I'm trying to shout that from the rooftops because people don't know. There's a myth that it's helpful or whatever, but it's not. So we're going to stick with methylfolate or folinic acid. But tell us all of this talk now about the antibodies. So you're saying with the antibodies, essentially we could have plenty of methylfolate in our blood, but it's not getting to the brain. And they're finding that's like in 70% of kids with autism, right?
Around about 50 to 60%.
50 to 60. And then and other neuropsychiatric issues, I'm sure development for babies, if their mom is low, or dad. No discounting dads here, but.
Yeah. So excellent question. The folate receptor antibodies is been discovered in the late 1990s. What they showed is if you have these antibodies, there's low folate in the brain. They published this article in a journal called the New England Journal of Medicine, which is it's one of the best journals in the world for scientific literature. So they publish, you just can't publish any data. What they showed is that if you have these antibodies, they're low folate in the brain. So these antibodies, in their presence, the body will have enough folate. You measure the RBC folate or serum folate, that will be normal, but the brain, it's not going. How is it happening, and what is the significance of these antibodies? And if you look at this is the brain, and I'm a poor artist, my artistic is good, and this is it's assumed that this is a connection between the brain, blood, and the brain, and this area is called the choroid plexus. This area is very important because, as I mentioned, brain needs a lot of folate because most of the functions, it's like a fuel for the brain. So let's assume these are folate receptor alpha, and these are some other folate transporter called reduced folate carrier, and this is folate receptor alpha, and this is also folate receptor alpha. Now, this folate receptor alpha is very critical because it is highly sensitive to folate. The concentration of folate is 2 to 4 times higher in the brain as compared to the body. So imagine something has to pull the folate into the brain for active. So it's highly sensitive, it will pull the folate, and normally it goes into the brain. Folate will go into the brain. Say, assuming this is the folate.
So 2 to 4 times more folate in the brain for all the jobs that we just talked about.
Yes, absolutely. 4 to 4 and higher in the brain, right? In the brain, brain. So, but imagine this, there's a block here. What happens? The reduced folate carrier, as you see, it's not a major pathway. These are the high path, this folate receptor alpha. We are forming antibodies against the folate. What means the body's own cells are acting against these receptors. Why? There are a number of reasons. One of the culprits is milk, animal forms of milk, dairy. I'll explain that later separately. But
it's an autoimmune process?
Yeah, autoimmune process. So the body's own cells are attacked. The immune cells are attacking these receptors. Now, these are antibodies. These are antibodies going and binding. This is called the blocking antibody, and this is small one is called binding antibody. The blocking antibody, as you know, binds to the receptor and blocks the folate from directly entering the brain. The binding antibody binds to the epitope, part of the receptor, some portion of the receptor, and kind of local creates an inflammation and doesn't allow the folate to transport into the brain. Essentially, both of them cause low folate in the brain.
Yes.
Right. Now, suddenly you have low folate in the brain, the brain needs folate. Now, brain is starving of folate, and that is presenting as clinical symptoms. In a child, it could be autism. In an adult, it could be schizophrenia or refractory depression. Or it could be a refractory bipolar. You treat other medications, you're not finding solution. This could be the thing. Or in a pregnant woman, in a woman, it could present as refractory infertility or repeated miscarriages, abortions, stillbirths, and pregnancy-related complications. So, because now the question is, where are these folate receptor alpha found in the body? Because imagine this is highly sensitive, and it's going to pull all the folate. The placenta, growing fetus needs a lot of folate. The genital tracts needs a lot of folate, and the thyroid in different concentrations. And so when this folate is, lacking folate, it presents as clinical symptoms. So we mentioned that. Now, how do we overcome this whole solution? We have to give high dose, prescription dose folinic acid. Now you're saturating this area with a lot of folate. And that is taking this pathway, the reduced folate carriers, just transporting a minute quantities, not like folinic, because you have a block and it's increasing the folate in the brain. So that's why we give a high dose. The maximum dose is 50 milligrams per day, divided into 2 doses. After 25 milligrams is the best sweet spot for absorption in the intestine. There's another receptor called the proton coupled folate transporter. That's the one which transports folate across the intestinal barrier. And that is only after 25 milligrams it gets saturated. It doesn't function well. gets tired of the folate. So you don't want to give more, but you want to give the sweet spot is 25 milligrams.
And it has a fairly short window, right? So you give it twice a day?
Twice a day. So basically the half-life, there's a short half-life. That means it's active for a short period of time.
Like 8 hours
Yeah,
or so?
Yeah.
Okay.
So basically you want to give that and increase the folate in the brain. Takes time. Some kids respond, when you take autistic kids, some kids respond in 2 to 3 days. Some kids take 6 months to respond. There are also kids who are respond after 2 weeks. Right? 2 years, sorry, 2 years. So it varies. There are other factors matter involved. That's why you want to talk to your doctor or a medical provider, your nurse practitioner, your physician, your medical provider to get insights into this pathway. They're the best to advise because you may have other problems, absorption problems. You may have other problems which can be combined and treated very well.
So for autism specifically, well, probably for anything specifically, being on the right nutritional support as far as gluten-free, dairy-free, low-inflammatory diet, plenty of vegetables, all that is the foundation so that everything can work properly.
Yeah, the number one thing, all of us, including children with autism, is food. We are in a situation where we tend to eat a lot of processed food. They affect our body more than anything else. So number one is focus on the food. The number two is everything else comes in. So if you're not doing the alternative, don't listen to Christine and don't do the best in making you get the right food, then you're in trouble. You can give high folate, but if your food is, if you have a gluten, you're taking gluten, then you are in problem. The one thing we mentioned is the dairy. Now, why is dairy a problem? Milk, animal forms of milk, dairy, that is cow's milk, goat milk, camel milk, sheep milk, all of them have bovine folate receptor. This bovine folate receptor, when crossing the intestinal barrier, they excite the body's immune system to produce antibodies. That is one thing which has been clinically studied, and avoiding the milk has shown that antibody titers, that is the number of antibodies, the blocking part, comes down and your symptoms improve. So milk is to be avoided. You may ask a question, how long? But I think it's a lifelong thing. At this point of time, we don't have any data or evidence to show that we can restart milk on this case.
Okay, so every animal's milk. I was going to ask you that. So probably even raw milk, which we do love for rebuilding the microbiome, but for folate receptor antibody positive kiddos, they can't do the raw milk either. Yeah.
So that is the number one thing, avoid the milk. Raw milk, organic milk, goats, people ask goat milk. Goat milk seems to be better than the others, but still it will cause its antibodies to rise. It's been shown clinically. So it's best to avoid. We have bigger problems to solve. So
go with the plant stuff, coconut milk.
Yes, coconut milk. Coconut milk is good because it has medium chain fatty acids.
Yeah.
They're very actually good for the mitochondria. They don't need anything to be transported in the mitochondria. And to transport this, folate inside, you need mitochondrial energy also. We need vitamin D. So these are some of the things you want to look at the mitochondria. You want to look at the vitamin D. So please consult your doctor, your medical provider. That's a person who can advise you on all this stuff.
So when let's say we determine they have the folate receptor antibodies, we decide to start on leucovorin, slow and steady, but we're also needing to give mitochondrial support because I think pretty much everybody has weak mitochondria due to toxins, right? Not enough sunshine.
Absolutely. So 90% of these kids with autism have this mitochondrial dysfunction, secondary mitochondrial dysfunction because of inflammation, because of the environmental toxin, multiple other reasons. So you want to look at the mitochondria for these children. You want to treat these kids with some mitochondrial support to move the folate, because this reduced folate carrier is not very effective in transporting folate into the brain.
It needs help.
Yeah, it is push. You need to push. We need support. Push, right? It's not the brilliant of the folate receptor. So you need to support. It's like a student like me, who didn't study very well. So I need some additional support.
You need support with B12N, like carnitine, CoQ10.
Yeah. So all that will help the mitochondria, and also vitamin D, which improves, which helps in the transport of folate. So these are very important things. And one more thing I want to tell you. You mentioned the word leucovorin. Leucovorin and folinic acid are the same. They're interchangeable, the same thing. The commercial name is leucovorin. It's calcium folinate. You also mentioned calcium folinate. They are all same. But active folinic acid is what it is. It's the base for that calcium folinate and leucovorin. It's a commercial form.
And methylfolate, though, does not have the ability to go.
No, it does. It does. So, so people often ask this question: why can't I use methylfolate? Actually, methylfolate is approved by the FDA as a medical food for the treatment of refractory depression. They don't say why it is approved, but it is approved. Okay, that means it's helping refractory depression patients. Imagine low serotonin, it's increasing serotonin. Challenge here is some of these kids react badly to the 5-MTH, the 5-methyl tetrahydrofolate, the active form, and they have more irritable symptoms. But if the kid responds and kid is able to tolerate it, that's also another form of treatment. But we also don't know the dosage. The best dose we don't know. Folinic acid is very well studied. That's why we tell folinic acid. 5-methyl tetrahydrofolate, we don't know the dose for autistic kids. We don't know that. That's the challenge we have. But some doctors do use it with good results, but we don't have data.
Okay, so I want to make sure everybody understands this as well. Even if they don't have folate receptor antibodies, are you saying that the folate receptor or the folate receptor antibodies from the animal milk we've always said gluten-free, dairy-free for our autistic children. Is that why they get better? Is they're able to get more folate to the brain even if they don't have an autoimmune process, or is that not connected?
So not connected. No, okay. So basically the antibodies are very rare condition. I mean, it's a small solution to a big problem called autism. But you have this problem when you give folinic acid. About 60% of the children respond to the folinic acid. So I think this is something every parent...
It's very safe to try.
Yes, very safe to try. Folinic acid also improves B12. Folinic acid also improves mitochondrial function. Helps to form new mitochondria because it increases RNA and DNA synthesis. Mitochondria is a separate subject. We'll talk. It has its own DNA, and we can talk in a separate talk. But the folinic acid is, when it's given, always add a little B12 supplemental dose, 800 micrograms of methyl B12 or adenosine B12, 800 micrograms. Why? Because when I drew the picture, the methyl group is picked up by B12 to act as a cofactor. If you don't have enough B12, that's getting trapped there. We don't want that. Now, B12 also has a problem. The majority of the supplement store, you go to your store and have B12, you will get cyanocobalamin. That is synthetic. Do not take it. You want to make sure it's methylcobalamin or adenosylcobalamin. Methylcobalamin is normally available in your pharmacies. Adenosylcobalamin may not be available, but you can talk to your medical provider. They can provide a resource for you to get adenosylcobalamin. But methylcobalamin is a safe form. Do not use cyanocobalamin. Cyanocobalamin is, once again, it's like the folic acid. It's not good. It's synthetic.
Wow. Okay. Well, this is a big deal. Can you tell us a little bit more about, you briefly mentioned, well, I also want to say this, that historically the only way to check your cerebral folate level is with a lumbar puncture, spinal tap, and we're just not doing that. So that's why the data is a smaller data sets than we would like, because we're not going to go around and do that. But are there, you mentioned autism and severe depression. Are there things that people out there might be thinking, oh gosh, I bet that I'm low on folate, or maybe I have these antibodies without, I don't know where I'm going with that.
Yeah.
We could cut
so it's folate is present in 5 to 7% of the folate antibodies are present in 5 to 7% of the 5 to 7% of the normal population.
5 to 7% of the normal population has these antibodies.
we didn't know the significance, but we know, there's a high incidence of depression, and there may be some of these patients. Traditionally, studies have shown, 5 to 7% in the normal pop, which is accepted in the scientific literature. But as you pointed out, apart from this population, there could be other population which could have these antibodies. Especially, there's a lot of talk about dementia. We do not know the answer. We do not have scientific studies to show that it's prevalent and things like that. Just going a little bit scientific, there's also a study which came out that it showed that families of these children with folate positive autism kids, like which have positive folate receptor antibodies, the mothers 60%, siblings, unaffected siblings 65%. Fathers, you mentioned fathers. Yes. Fathers are the biggest culprits. So they also have these antibodies, and we do not know the significance of this. And only larger clinical studies and data sets will explain, what could happen to these people. So this tells us that we need the support of all of you. Only then we can have more data, and at least in the future we can take appropriate action. Okay. So essentially, there's a lot to learn. What we know is what we know, and I think we will continue to learn.
Yes, it's very important. So your lab is doing good work. We use your lab to check our kiddos to see if they have the antibodies. And I think, with Dr. Fry and his book, this is just going to hopefully the message will get out.
Yeah, thank you. Now, I do want to credit Dr. Fry for his commitment to improve the lives of children with autism all over the world. And also Dr. Eduardo Cardos, who discovered these antibodies. These are gentlemen who have pioneered this work, and they are committed to improving the lives of children with autism and other neuropsychiatry. Possibly there'll be a day when we will be able to solve much problem in pregnant women, and rather than giving folic acid, we may consider giving an alternate form. We need more data, we need more studies, and that will help. I think more researchers joining this group will help this whole field to go forward.
What do you think about other things like, I just think about failure to thrive, poor growth. I mean, I don't think it's all neuro presentation.
Yeah, so there's a couple of things, right? Midline defects. Does the mother have these antibodies? Are they the insert is there, but not a great amount. The titers are not that high. The antibodies levels are not very high. Lower levels of these antibodies mothers have. We also said 5 to 7% normal population has it.
Yes.
If these mothers have it, are these kids going to develop midline defects? We don't know. The answer is don't know. I think, Christine, you can ask these mothers, and we can find a solution. You can help us find solutions, and
I'd like to. The first study I would love to do is babies that have the tongue tie, lip tie. Just find out what prenatal mom was on. Find out if she has the antibodies. Figure out what's with the increase. But all autoimmune is on the rise post-COVID, post the lockdowns. That whole season has increased type 1 diabetes. I mean, all the autoimmune. So it would make sense that this too is on the rise.
Yeah. I hope, with all of us working together and trying to find this solution, I think hopefully the next 5 to 7, now, 1 in 36 child, 1 in 36,
1 in 31
born in the United States will have autism. But I hope to reduce this number, bring that number to the, keep increasing the number to 1 in 1,000, 1 in 2,000, 1 in 5,000.
And we're doing that at Shine. So we just have to take really good care of these babies from the get-go.
I think whatever I know of your clinic is that you have a commitment for these children to be holistic, try out naturally, not use excessive medications. And this is the starting point. And educate them, about the fortification of food. Starts with the food, right? So that itself it can change. See, imagine a mother, whenever mother is pregnant, mother is eating healthy. it could start there, right?
Oh, it just occurred to me, our baby formula is fortified with folic acid?
Possibly, yes, most of them.
Oh.
So, yeah, so we do have, I think, the challenging, I think, with the knowledge and with more awareness, we can we can help the society change. Excellent question on the fortification of the food. Now, the mother's body, when it's pregnant, it's like a data center with thousands of cameras. It's taking all the mother's primary duties to prevent any disease in the child. So mother is collecting all the information through the 1,000 cameras and producing breast milk, which is going to help the child. So breastfeeding becomes very important. The breast milk will have antibodies and immune system to prevent the kids from having infection or whatever disease. So this is a long topic. I think in the next series we can talk about those things. I think that's very interesting. This mother's health is critical. The mother health is so critical to prevent disease. I mean, a mother working in a clinic exposed to a lot of infection definitely has a better immune system, is going to prevent those diseases occurring from the child. So, there's a lot of nuances. So I think we can have two more topics, one on mother's health and one on the mitochondria.
Yes, we will meet again. Thank you so much for your time and your very detailed, clear explanation of that.
I hope this was very helpful for the audience. I hope this helps. Number one, few things to remember. Folic acid is bad. Cyanocobalamin, that is B12, the synthetic forms are bad. Think about that first. Number two, your family, friends, anybody, your neighbor, any autistic kids should be think about low folate in the brain. That is one of the things we can cure. We can treat them effectively. Shine Pediatrics have a very good system, and there are a lot of providers there who are well educated, well aware of this system for the last several years, and they can provide you the solutions. And I'm sure you're looking at the GI system, you're looking at all the other things.
Yes, wonderful. Well, thank you.
Thank you for the opportunity, Christine.
You're very kind and generous, and we appreciate you very much.
Thank you so much. I hope it helps.
It will. Thank you.